Welcome to All Things Cardio-Oncology. My name is Steve Caselli. I'm the Executive Director of ICOS. On November 10th and 11th, a number of ICOS friends and colleagues attended the American Heart Association in Philadelphia, Pennsylvania. And there we had an opportunity to speak with them about how the AHA was addressing cardio-oncology at the meeting this year. There might be some background noise in these episodes because we're recording live in the hall, but other than that, I know you're going to enjoy these episodes, so thanks for joining us. We're at the American Heart Association meeting in Philadelphia, Pennsylvania, and I'm here with some good friends and colleagues and board members of ICOS, Dan Lenihan and Teresa López-Fernández. Teresa's in from Spain. And we wanted to talk today a little bit about cardio-oncology education and its development both in the U.S. and abroad.
Thank you so much, Steve. And Teresa, it's always a great pleasure to see you in person, and thanks for coming to the AHA meeting.
Thank you for having me.
We always, we're always greatly benefited by your presence, so thank you for being here. I think what we wanted to hear from you is kind of your experience about the development of curriculum, but also our curricula as it relates to cardio-oncology, and exactly how does the European perspective differ from maybe what we're trying to struggle with here in the United States. So to just start off, where have you been so far to this point in terms of developing educational tools or curricula?
Thank you, Dan. I think that this is a tricky question, and I'm going to try to answer in different ways. So, as you know, in Europe, the ESC is the one who takes the lead in general for the global education and training in cardiology, and we have the ESC Council of Cardio-Oncology, that is the organism that is in charge of all the cardio-oncology activities, but of course in partnership with other ESC associations and also with oncology societies in Europe. The main problem in Europe is that we have a lot of countries with different health systems and with different university programs. So it's very difficult to build a global European training program in cardio-oncology. So the decision from the ESC perspective was to create a European core curriculum on cardio-oncology to update the current general core curriculum for cardiologists. And we did this job in collaboration with the Cardio-Oncology Working Group of the Heart Failure Association. So the aim of this core curriculum for cardio-oncology is to establish what are the minimum standards that are needed to label a professional as cardio-oncologist, but also to set the minimum requirement that every cardiologist should know about cardio-oncology. Because when we speak about training in cardio-oncology, as in other subspecialties, we have 3 different levels of training, and of course you are the one who create these levels, the basic level, the advanced level, and the expert level. So in Europe, most of the cancer patients are seen in general cardiology clinics. So we really want to focus on good training of cardiologists, general cardiologists, to be sure that they are able to make appropriate clinical decision and appropriate referral to these patients to the excellent centers in cardio-oncology.
So I think one of the biggest challenges is when you have, so if you're just thinking about cardio-oncology in general, there's at least 2 major issues that you have to factor in differently than any other subspecialty, for example, in cardiology. And so that is, number one, the patients are not our usual patients. If you take about the whole world of cardiology, generally speaking, we don't think about the patient with cancer as part of that world. We do, of course, but the whole scope of cardiology doesn't really think of that. And so there's that. And then the other part is when you're talking about any sort of training component, and you have one discipline that's driving all of the training, but these patients are being treated by a different discipline. How do you incorporate the other discipline, in this case, hematology or oncology? How do you incorporate that into the curriculum? So this is a real challenge. It's, number one, the patient population is outside of our normal scope for all of cardiology. And then the perspective of an oncology or a hematologist is completely different than a cardiology perspective.
So now the ESC curriculum for cardio-oncology is made by a group of people that are not only cardiologists but also hematologists, radiation oncologists, medical oncologists, and nurses also. They contribute to this curriculum. But is it true that the curriculum just is focused on what a cardiologist should know about that? But we do not refer of what oncologists or hematologists should know about cardio-oncologists, because the curriculum is organized by the European Society of Cardiology. At a national level, and I want to explain you my experience, we have a very robust partnership with our Spanish oncology societies, and we have created a master that is a theoretical master, 1 year and 60 credits, that more or less 40% of the documents that the students should read is about oncology or hematology, and 60% about cardiology. And then we are starting running clinical training programs that include exactly the same proportion. So when a cardiologist wants to be training in cardio-oncology, during 1 year, they spend 40% of the time out of the cardiology service in the hematology, oncology, or radiation oncology area. We are starting now to involve them also in basic research, but we don't know if this is going to work or not, honestly, and because the time is very limited in 1 year. And we also incorporate in this program cardiac rehabilitation, cardiac imaging, according to the background of the cardiologist, and of course inpatient and outpatient consultations.
So I think one of the concepts that certainly I always struggle with on a day-to-day basis, but certainly when we're talking about sort of bigger projects, is the paralysis by paralysis by analysis, where you start looking at things and you realize, wow, this is really complex, and I don't know if I can do anything here because it's just it's too complex. Well, of course, I always want to fight against that, because if we don't do something, then we're not meeting the real needs. So there's no doubt that from a patient level point of view, having important cardio-oncology input in their care makes a huge difference in their overall outcomes, not only from a cancer perspective, but from a cardiology perspective, because, you may tolerate some degree of cardiovascular toxicity so that you can get more appropriate cancer treatment. So that whole space where you're really having active collaboration between two major disciplines with completely different perspectives is a daunting task. But I also feel that you got to do something. So how do you see the curriculum that you're developing? How do you see that it can move to be incorporated better in actual practice? How do you see that?
Yeah, this is not easy, but I agree with you that we need to do something, even if it is complex or even if it is not perfect, which in general, when we start one new action, it never is perfect, and we cannot wait until we have the perfect solution for everything. But I I think that with the guidelines that the ESC and ICOS build together, and with the core curriculum, professionals can also approach their health system managers and say, look, we need to cover this aspect for all the cardiologists, because they should be aware that X problems can happen at that time, at least aware of that, and then apply their cardiovascular knowledge. And they also can ask for more resources in order to increase the facilities for patients to be treated when they have maybe not when they have a cardiovascular problem, before they have a cardiovascular problem, because we really need to, in my view, to concentrate the core curriculum aspect on the prevention and on cancer survivors.
And one of the things that has always been sort of a general struggle is whatever is going on in sort of U.S.-based entities, so like the AHA or the ACC, does that apply to the ESC and vice versa? So if the ESC develops guidelines and they have their thoughts and they put them down in a document, the AHA or the ACC may not be fully aligned with certain aspects. So how do you see that we can avoid those sort of struggles in cardio-oncology?
Yeah, this is a big problem, particularly for a new field that is underdeveloping. And I think that at that point, ICOS has a major role in trying to be the key that open the different doors, because for big societies it's very difficult to get agreements, and the last time that the ESC made joint guidelines with the American societies was 8 years ago. So I think that we organized from ICOS a meeting with different societies and stakeholders, and the idea is to get an agreement on at least the one or two basic key points to build cardio-oncology. And probably it makes sense that some recommendations are not the same, because the healthcare systems are not the same in Europe and in US, and guidelines have an impact from the legal point of view. So maybe we cannot recommend exactly the same thing, and the EMA and the FDA regulation are not exactly the same. So we cannot expect to have universal guidelines that cover all these points, but at least definitions, at least some key agreement on how to organize a long-term survivorship program. Not on the details on when to perform an echo, but at least what are the goals. And if we are able to agree on these goals, I think that this is a big dream.
Yeah, no, I agree. And I think it's a real challenge to kind of get, important societies to kind of see the other side, because they're focused on whatever it is that their main job description is. And so, but I think I suppose that's what we've self-adopted at ICOS, is to try to figure out a way to get people to see things together in a hopefully a clear manner. But and I really, your efforts in conjunction with Alex Lyon in the UK to get the guidelines completed were just an amazing achievement. So we're very thankful about that. And how do we actually implement those guidelines or raise the level of practice that people are performing in different areas of the world? That's really the current challenge. So, well, Teresa, thank you so much for being here and for talking with us today. And we, of course, are always looking for ways in which you will raise our standards in the future.
Thank you very much, Dan. Right, it's a pleasure.
Thanks.
For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.